Welcome, everyone, to A Mexican Crossing Lines with your host, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You're listening to 88.1 FM, KPPPLP, Fargo-Moorhead, where we are adding local color to your airwaves. And tonight, I am going to do a special show on disaster relief. Of course, we are doing daily broadcasting, bringing you the latest information about the coronavirus, and we intend to keep you up to date moment by moment on what is going on in the country and around the world. First of all, I would like to thank all of the people that have been calling in, writing in, messaging us through our social media platforms about the coronavirus. Continue to do that. We appreciate your comments, questions, and of course, we invite you to follow us on social media, on YouTube. If you're listening in the Fargo-Moorhead metro area, you can call in and leave a number on our message line or email us as one of the many ways that you can get a hold of us. And of course, we would love it if you would support the work of our station, especially during these difficult times. Duke, how can folks do all of those things?
Well, the social media has been pretty good. It's you can find us on Facebook at 88.1 FM Fargo-Moorhead, Mexi-Can, and the People's Press Project. And as Cindy said, you can do a call in and leave a message, 701-566-0917. Again, that number is 701-566-0917. Email Cindy at kpppfm.com or me, Duke, at kpppfm.com. Also go to kpppfm.com and look at our programming, and also you can go there to help donate. Go to kpppfm.com/donate. Make a tax-deductible contribution so we can continue this work. Also, you can go to YouTube. Duke 1517 is the name of the channel, and we take all of these streams we do on Facebook and we premiere them on YouTube for a whole nother audience. We appreciate that you are keeping in contact with us, that you're crowdsourcing material for these shows. We are doing hyper-local and national and international information, and it's going to be a great show tonight.
Yes, let's start with the numbers. So yesterday we were at 529,093 cases of coronavirus worldwide. Today we are at 590,594 cases worldwide. That's quite a jump in just one day. We are now in the U.S. over 100,000 cases. Italy is at 64,000. China is at 81. Spain is at 64,000. Germany is at 50,000. France is at 33,000, along with Iran, who's also closely trailing behind them. The United Kingdom and Switzerland are both in the tens of thousands, and South Korea and the Netherlands are close to the 10,000 mark. In the United States, we were yesterday at 83,672. Today, we are now currently, as of this program, at 102,396 cases. That's already...
It went up 1,500 in the past hour.
It went up 1,500 in the past hour. That's correct. We are now at 1,607 deaths.
Wow.
And 2,471 recoveries. New York is up 5,833 new cases since yesterday, for a total of 44,810 in the state. That's an increase of 53 deaths. New Jersey is up 1,949 cases, and that is a total of 8,825 and 27 new deaths. Michigan had 32 new deaths. Washington had 28 new deaths. Massachusetts is now at 823 new cases. Michigan is also at 801 new cases. How are we doing in the states of Minnesota and North Dakota with regard to cases? Duke?
I forgot to put those in the script.
But I thought you were going to do North Dakota and Minnesota for
But I
us.
will look real quick
Oh,
at the
I can
folders.
find them for you if you want.
Let's see.
We're at Minnesota. We are at three. I thought you had a graphic. We are at 398 cases in Minnesota, and that's 52 new cases since yesterday. We have a total of 4 deaths in the state, 2 new deaths. In North Dakota, we are at 68 total cases. Wow. That's an
Really?
incredible rise in number. We're almost at 70, and that there's 1 death now reported in North Dakota. We've had 16 new cases since yesterday. The numbers are definitely growing. South Dakota has 58 cases now, 12 new cases, no deaths reported as of yet. So the numbers are rapidly increasing across our country, seemingly with no end in sight. This afternoon, during a press conference, Governor Burgum announced the closure of businesses operated by licensed cosmetologists, which includes manicurists, estheticians, massage therapists, barber shops, tattoo parlors, body art facilities, and all of these businesses are not allowed to operate until the ban for these businesses to operate is lifted. This all goes into effect on noon Saturday, this Saturday. So I know that there were a lot of folks in those trades talking on social media about their concern that their jobs were going to reopen on Monday and they didn't know what they should do because they want to social distance, but they also feel like they need to go and work if their job is open. We had an update on our flood story. We erroneously said that the video we showed you yesterday of people preparing for flood season in Fargo was actually from last year. Duke, can you explain?
Yeah. So sorry about that. We have to retract that video. The video was actually filmed a year ago. But I looked into the flood scene and what's going on, and there was a story put out today that actually uses last year's imagery, like we used yesterday, which is actually inaccurate. But the flood sandbagging volunteers stopped filling sandbags 12 days ago in Fargo. They have enough sandbags in Fargo. The flood is actually, the crest has been lowered for what they previously predicted, but there's still going to be some flooding, and it's a major flood stage. I could not find out any information on how they're going to handle volunteers. They have lots of sandbags, but how are people going to put them up? I don't know if it's going to be city staff, or if they're going to do a call into the community to help. That isn't clear. But still, it's a dilemma because we need the sandbag and yet we can't be close to each other. We have to practice social distancing. So I'm not sure what they're going to do. Couldn't find any information on Sandbag Central today or the city website, but we'll keep you posted on that.
In other news, a local business that makes mattresses called Comfort King is switching gears in order to help with the shortage of masks. They're going to be producing masks for protection at Comfort King. Isn't that nice?
That's great.
Yes.
Great to repurpose.
Yes. And many other businesses are going to be doing the same. HPR, the High Plains Reader, locally has announced that it is going on hiatus. The independent arts, news, and entertainment tabloid, full disclosure, I used to be the editor of that newspaper, just announced that as of Thursday, March 26th, on their Facebook page, they wrote, like most of our business partners and customers, HPR is on hiatus and will not be hitting the streets again until we all come out of this on the other side of COVID-19. We wish everyone well, stay safe, take care of each other. It's everyone. So we are all in this together. When HPR returns, tell our advertisers how much you appreciate that because of them. The High Plains Reader exists. So, this is a newspaper that's locally published once a week, and unfortunately, they would have to go out to take the paper to different venues. My brother Raul, who's the co-owner of the paper, was quoted as saying, "In order to print, we need to have enough advertising to make that viable. We're on hiatus until those advertisers and those activities resume."
Wow. And I thought about that too because they distribute their paper. It made me think about the Fargo Forum. How are they going to distribute their paper? It's just going to be home deliveries, and also the advertisement. I mean, they should be advertising. We deliver, we're open, but High Plains Reader, they put a lot of their papers in public places, grocery stores, but then bars, liquor stores, and all sorts of other businesses that are closed. So I can understand why they would take a step back and wait and see what happens in the future.
Now, we received a message from a woman whose husband is a taxi driver. She wanted to know what our listeners thought about the semi driver going through a local McDonald's being refused business. In her message to our station, she said, I wanted you all to know that what a local Moorhead McDonald's did to my semi-driving husband this morning. They refused to serve him in the drive-thru because he was on foot. Such hospitality. Hoping this goes viral. Well, we reached out to the two local Moorhead McDonald's to find out what their comment was, and this is what they had to say. Contacted our station saying that she wanted to know how our listeners felt about the local McDonald's refusing semi-driver service to her husband. I wanted to know if you guys had a policy or a comment about that.
So I wasn't in charge during that, so I'm actually not 100% sure about the whole story.
Okay.
But I do know that right now with all the stuff with the virus, that we're currently working on a new policy for serving semi-truck drivers. Because right now it's less that we can't help them; it's more that we just they can't fit in our drive-thru. And since we can't have anybody in the law in the lobby due to legal reasons, there's really nothing that we can do about it right now until our actual store comes up with or until our actual company comes up with a policy to do that.
And are you aware of if they're working on something like that to?
Yes. As of right now, I know that they are working on a policy to help serve semi-truck drivers on this.
Fantastic. Also, do you have any app or something where the drivers could order beforehand and pick up at the door?
Yeah, if they could potentially use the McDonald's app, which allows you to do a curbside pickup. Although I don't actually know if we're still doing curbside pickup. But I believe that that does allow you to order ahead of time, and then we can just bring it out to you. That could also be an alternative that we might be doing, but I'm not really sure right now.
Fantastic. Well, thank you very much for your time, and you have a great day.
Yeah, you too.
All right, bye-bye. So I did reach out to the other McDonald's as well, which did not serve this semi-truck driver. The caller, the manager you just heard was the McDonald's that he went through. Okay. He said he wasn't there at the time that the incident occurred. But I did reach out to the other McDonald's as well, and I asked them what their policy was on serving truck drivers at this time. And they also repeated what this manager said, which is that they're scrambling to create a policy. They were caught off guard. He actually said they've been caught off guard by this pandemic. They're trying to figure out a way to serve truck drivers. They very much want to serve truck drivers, and they're coming up with a safe policy for their personnel that, meets the requirements of corporate in terms of them not letting anyone into their restaurant, but also accommodates the truck drivers as they continue to drive across country, delivering our goods.
They need to eat.
Of course they do.
Don't advocate that everyone needs to be eating McDonald's every day, but it's you need to stop and you need to get something to eat, and there's something right off the highway. You should be able to get food. It kind of shows how people are taking it more seriously now, but it's slowly becoming serious. It's like in North Dakota, they still haven't locked down the state. They're starting to close businesses, lock down more things. But every day we wait, the more days we wait, the more we prolong us not being in contact with each other. If we could just all hide out, be quarantined in our houses for 2 weeks, that would make a huge difference. But each day that goes on where more and more people are in contact with each other, it just postpones that isolation that we need to do.
And, we don't have to, sit on our hands and wait. We can reach out to our local leaders. We can reach out to our state leaders and the governor and say, we urge you to put a stay-at-home order so that we can all be protected from the spread of this virus. Nancy comments that Idaho's governor has just issued a stay-at-home order. Fantastic. That's great. Good news to hear. And Kansas said that their state already has as well. Thanks, Tracy, for that. We hope to see more and more. And I wanted to shift really quickly and talk about addiction. We have talked about homelessness. I want to start talking a little bit about addiction because during this time, there is going to be a lot of people whose addiction is not going to stop just because there is a pandemic. And as the sources of drugs, illicit drugs, begin to dry up, as dealers go underground, what have you, there are some very dangerous drugs that are appearing and that are killing people. Here in Minnesota, law enforcement warns that a deadly drug known as fire is being distributed in northern Minnesota. And this was a report out of Bemidji that a highly potent, extremely dangerous substance suspected to be fentanyl is being sold as heroin under the street name Fire in northern Minnesota, and the Pine Prairie Drug Task Force is warning users that the substance could be deadly. According to a Tuesday, March 24 press release from the Pine Drug Task Force, Prairie Drug Task Force, the suspected fentanyl is a fine crystal with a pink color and is reported to be potentially fatal to both users and those who inadvertently come into contact with this substance. That is very scary. Several arrests have already been made according to the release, but no charges have been filed. Well, folks, what do you think, Duke? We're going to see more of this, or do you think that people are going to maybe seek help for,
I think we're going to continue to see black market drug sales and use. Because it's just not going to stop. And it's really unfortunate this whole epidemic with fentanyl and and people are shooting heroin still. It's just, I don't understand it. I'm not addicted. And, it's hard for me to understand, but I know that people will continue to seek that out. People will continue to sell, and, it's just one of those deals that in our society, we have not solved that problem. It's going to continue even through a pandemic.
Yeah, I think you're right. And there's something else I thought might be discontinued during the pandemic, and that is protesting. We've been reporting on a lot of mercenary activism, both here at home and abroad in Mexico, having to do with the mass migration in caravans. And we've kind of seen a lot of that dry up. In fact, we were talking in the last few shows about how their ability to protest has been hampered. Well, I guess we spoke too soon because I'm going to show you a video here. They're outside the governor's mansion in Minnesota, and they're holding a car sit-in. I never even heard of this before.
Yeah.
Outside of his house, calling for him to evacuate detention facilities under the hashtag evacuate the camps before the COVID virus turns ICE detention centers into what they are calling death camps. Take a look for yourself. See the cars parked outside. Some of them are rolling by. Does that guy have a coffin on his hood? What is that?
I don't know.
It looks like there's a coffin on his hood. Like they strapped a coffin or a fake-looking coffin on the hood.
Boy.
Like it's supposed to be some kind of a funeral procession.
Uh-huh.
I don't know. But, folks, I think the governor has got bigger fish to fry than to deal with these car sit-ins. I just found that incredibly entertaining. And I wanted to talk more seriously about what our states, what our country really needs to be focused on, and that is giving support to our healthcare workers.
For sure.
This is how you mitigate the damage that is going to be caused by this virus. It's already here. It's not going to go away. We are not immune to it. Nobody is immune to it. Many, many people are going to get sick, and many, many people are going to die. And so, as this crisis is ramping up, more and more healthcare workers are coming forward to say they are not equipped for this crisis. Locally, somebody posted this. I did redact their name, and they were looking for personal protection equipment for their daughter, who's a nurse. This is very sad to me that folks are having to beg the public. Anyone does anybody out there have masks? In a local story, nurses, I think it was in the Bismarck Tribune, nurses were able to get N95 masks from the mechanic shop of one of the people in the story. She went to her brother and got the masks.
Got masks from there.
I mean, I'm glad that the nurse was able to source some masks from a local mechanic, but this is America. We should have the necessary equipment for our healthcare workers, especially during a crisis. It's totally unacceptable. It should be unacceptable to all of you. In Missouri, the numbers are jumping precipitously. At least 502 people in Missouri have tested positive. That's a 41% jump in just one day.
Wow.
And I know that as we get more tests, we're going to actually be able to see the numbers spiking, as I have been saying. As this happens, the healthcare system becomes more and more overwhelmed, causing hospitals all across the country to consider whether or not they impose do not resuscitate orders across the board. This is very scary given the fact that a lot of folks could be having heart attacks during these episodes with the shutdown of their respiratory system. And this is causing nurses and doctors all across the country to start burning out and breaking down. We received a post by a local nurse that posted a picture of her with mask marks on her face from having to wear these masks all day long. And she posted this photo saying, "I broke down and cried today. I cried of exhaustion, of defeat, because after 4 years of being an ER nurse, I suddenly feel like I know nothing. Because my face hurts after wearing a N95 mask for 13 hours, which happens to be the same mask I wore yesterday for 12 and a half hours and the same one from all of last week. I don't know how many times I've heard statements, but that's what you signed up for. Just no. I signed up to take care of sick patients. Yes, I did not sign up to be unprotected by their sickness. I did not sign up to be yelled at by angry patients because our government failed to be prepared. I didn't sign up to risk mine and my family's health and safety because people wanted to go on their vacations after they were told not to. An ER nurse in New York died today of COVID-19. He was in his 40s and had very mild asthma. And excuse me, that's it. This is not just a tall tale. This is a real risk. I have to go into every patient's room, and in the back of my mind, I think, this could be the patient that gets me sick, that kills me. This could be the patient that gives me the virus I bring home to my children or asthmatic husband. This is my new reality. But this is only the beginning. We haven't even scratched the surface of the impact of what this illness is going to make on our country. And I am scared. So am I.
Yes.
I also am scared. That was from Cindy. Cindy, I'm also scared. From one Cindy to another, I'm scared for you. I'm scared for your family. I'm scared for all of the healthcare workers who are now, incidentally, in New York, approved to split their ventilators. I don't know how the mechanics of these things work and if
Yeah.
it's going to do a good enough job. When you split a ventilator, does it?
It's less pressure, It's I don't know if you can crank them up higher, but
It
you have
can't
to have
be
that
ideal.
pressure.
It can't be
No,
the way that
they're not designed for it, that's for sure.
meant to work. But unfortunately, these are the kinds of choices that we are making in the first week of this pandemic hitting our country. Can you imagine what it's going to be like in weeks 2, weeks 3, weeks 4? Well, folks, it is literally bringing some doctors to reconsider whether or not they feel like we are keeping the social contract. The social contract that doctors and patients have and have had in this country. One doctor named Ruben posted, "You have broken the social contract. That agreement whereby I as a doctor agree to work long hours, sacrifice my youth, my health, my time with family to come to work and care for all of you and your ills, as you as a society and you as a society agree to provide me with the equipment, the supplies, and the social conditions to care for you. You have decided that your spring break trip, your hairstyle, your entertainment are more important than my life. Every day I walk into the ICU and see the exploding numbers of COVID patients. Every day I walk into the 23-year-old patient's room. Every day I go home after a 15-hour shift to see my 3-year-old daughter and 6-month-old son. I am afraid. I don't let anyone know. I put on a brave face, but I am scared to death that I'm going to leave my children fatherless. Or worse, be the person who gives them the disease that takes them away from me. You believe that I'm a hero, and that you telling me that makes it all right. I was trained to always put my patient's health over my own, and there is a part of me that still believes that. But what does you calling me a hero mean to my fatherless children? How will your kind words bring back one of my dead babies? I would rather be a healthy father than a ventilated hero. I know this may be selfish. I know that in becoming a doctor, I made an agreement with society to provide selfless care even at the risk to my own life. But you with your beach trips and your hairdressing appointments, with your small parties and your disbelief in science, with your political arguments to explain away the deaths that I deal with each day. You have broken the social contract. You have left me overworked and understaffed. You have left me without equipment or support. You have told me that your economy is more important than me and my children's lives. Each day, as I again wipe my protective equipment with bleach wipes for use for the 4th day in a row and walk into another COVID patient's room, I must weigh the value of me and my family's lives against the risk. We once had a social contract that led me to believe it was worth it, that sacrifice came from all sides for our common well-being. But you, America, have broken that contract and left me wondering if I should continue to hold up my end when the cost may be so high. For today, for now, because I believe in that social contract, because I believe in you, I continue to work extra shifts, to daily risk myself and those I love to save you and those that you love. For now, I buy extra life insurance. I prepare my will. I write letters to my children in case I am gone before they grow old enough to know their father. But the day may come when the doctors, the nurses, the police, the firefighters, and the EMS providers in this country decide that since you broke your side of the contract, They're no longer willing to risk their families' deaths so that you can continue to deny the truth of this current situation. Please stay home. Please stay safe. Please contact your political representatives to encourage them to act. Please know that, to me, no amount of economic collapse is worth leaving my children fatherless. Please hold up your side of the social contract. Now, I will head back to the ICU to save another life and to pray it doesn't cost me mine. God bless. Stay safe.
Wow.
Duke?
My God. And he's threatening to quit, and it's like, if we force the healthcare workers out of doing healthcare, I mean, that's going to be horrible. And we are squeezing them very hard. And people are, we've shown every day we've shown some sort of imagery or statements from people in healthcare that are sleeping in their garages, they're not coming home. And the pressure must be immense. But without having, relief workers and having the medical supplies they need have just added to that. And also the increase in these cases because we haven't taken precautions and we continue not to. So it's going to get worse and worse. And so, wow, it was really sad. It's really, really sad story.
And doctors are writing their wills. This isn't just one instance.
Yes.
These are going to be stories you're going to be hearing every day. And I hope that you are all listening. I hope that you are paying attention. I hope your empathy isn't broken, because our healthcare workers are crying out for our help, and we have to do everything in our power to help them. It is not enough for us to stand on our balconies or sit at our windows and clap for them as they go to work. It is not enough for us to sing their praises on social media or tell them that we appreciate their service. It's hollow to tell these people that they signed up for this when we are sending them in to fight the war of our lifetime without the proper equipment to save theirs. Mm-hmm. So doctors in this New York Times article that I will share with my audience are definitely preparing for the worst, even as the rest of us are still vacillating in so many states about social distancing and shutting down our economies. In this article, Michelle, who works at Emory St. James Hospital in Atlanta, said she feels like she's working at Chernobyl. She's an anesthesiologist responsible for one of the most dangerous parts of tending to a patient with coronavirus, intubating. Mm-hmm. The procedure, which involves snaking a tube into the patient's trachea, is so dangerous because it brings the doctor close to the patient's mouth, which is constantly shedding the virus. Patients sometimes exhale or cough as the tube is inserted, which aerosolizes the virus, allowing it to hang in the air for several hours. Last week, she intubated 2 patients with COVID. You're aware of every moment that you're in there, she said. 10 seconds, 20 seconds, 30 seconds. You feel radioactive. She said that there are invisible risks that trail with you. And those invisible risks, a trace of the coronavirus under your fingernail or on a strand of your hair, give doctors like this one nightmares just because she's so worried about her own health and that of her colleagues. And also because waiting at home, she has a husband and 3 children. So every day before she leaves the hospital, Dr. O takes a shower, washes her hair, changes her clothes. Then she does the same thing when she gets home because her old clothes are now contaminated because she wore them in her car to drive home. She takes a diluted bleach solution and wipes down every surface that she's touched, doorknobs, car handles, phones, so on. Not so long ago, she would have thought those precautions were crazy, but now they seem very reasonable. For 2 weeks, she's been sleeping in her basement while her husband, a surgeon, sleeps in the bedroom because one of them has to stay healthy. Dr. O's situation is no exception. It's now the rule among doctors and nurses treating coronavirus patients. Since the end of February, another doctor by the name of John Marshall, the chairman of the emergency medicine at Maimonides Medical Center in Brooklyn, has slept in separate rooms from his wife. Living at home allows Dr. Marshall to see his 3 children for the hours or 2 that he isn't sleeping or working at the hospital, when dozens of patients with COVID are being treated. But others in his hospital have sent their families to safer ground or chosen to protect themselves by staying alone through this crisis at an Airbnb or at a hotel. As soon as next week, Columbia University is planning to turn some of their dorms over to doctors and other healthcare workers so they can avoid long commutes and the risk of infecting others, according to a university spokesperson. Some doctors already have had the virus. Dr. Risha is a gastroenterologist fellow at Lenox Hill Hospital in Manhattan. Her husband is also a doctor. He tested positive for COVID-19 on Wednesday, and they have a 5-month-old daughter who is breastfeeding. The family is now split. Dr. Risha's husband is at her brother's house in Yonkers. She's in her bedroom waiting for her own test results, and the baby is living with their in-laws. I haven't seen my baby since yesterday, she said. She wonders if the baby would be safer living somewhere else. I'm so conflicted. She's pumping milk so her in-laws can feed the baby, but she's terrified of getting her baby or her in-laws sick. We know what to do when a gunshot wound comes in. We know what to do when someone comes in with sepsis or a heart attack. In this instance, there is uncertainty about how to protect yourself, and so there is uncertainty about how to protect our families. I would marinate myself in hand sanitizer if I could, said Dr. Sharon Levine, the section chief for geriatric medicine in Massachusetts. Early research shows that healthcare workers are more likely to contract the coronavirus than the average person when they get it. And when they do, they are more likely to suffer more severe symptoms. Many doctors are already rationing their protective gear, gloves, and masks that are necessary to keep them safe, and they're also drawing up their wills. Dr. O and her husband sat down over the weekend and updated the list of who should take care of their children if both of them die. We have it 4 deep now, she said. The 2 top choices are older, and those people are in a high-risk group. The 3rd person is a doctor, so we've added a 4th person who is at low risk of contracting this thing as the backstop in case it comes to that. Isn't that terrifying, Duke?
It is, too, and it's like, I feel so sad because even with all those precautions, there's a huge chance they're all going to get the virus because they're in such close proximity. The visual...
For 15 hours a day.
For 15 hours a day, and, when you're sticking a tube down someone's trachea, and they're coughing on you, and you're hoping that your gear is preventing it from getting inside of it, and you have to keep on going, and then, you're not doing a shower till night, and then you're switching clothes and washing those and wiping down surfaces. It's like, how can you even eat during the day when you're doing this sort of job? When can you actually put food in your mouth or scratch your nose or scratch your head because you're itching or rub some ointment on the sores you have on your face because of the mask? It's just horrible.
Dr. Jane Van Dis is an OBGYN in Los Angeles and the medical doctor for Maven, a telemedicine platform. She's also a single mom. Quote, I realize that if something happens to me, that my life is all in my head. So on Saturday, I combed through all my policies, life insurance, disability, all my credit cards, my mortgage, my auto loan, trying to think of all of the details of my life so that if someone were trying to take it over for me, they could. Dr. Marshall has also been encouraging his colleagues who don't have wills to draw them up. We know what's coming, he told them. There's a good number of people who are going to die here. Healthcare workers will be part of those numbers.
Yeah. Boy.
Meanwhile, in other news related to the handling of this virus by the administration, a political ad was posted on a variety of different television stations that tracks what President Trump said about the virus as the virus progressed, as more and more people became contracted the virus, and as those numbers began to shoot up, and he finally declared a national state of emergency because of the pandemic. And his administration has now sent a cease and desist order or letter to those who made the ad threatening legal action. What do you think about that, Duke?
Well, I can't remember if I think I have seen this ad, but it was snippets of him saying these different things, which he said.
It showed a quote. It didn't actually have him say them. It just showed a quote.
Yes. Oh, showed the quote and stuff like that. But it's like, why do you want to get into a legal fight about that? I mean, that doesn't make any sense. The government shouldn't be spending time trying to sue some media outlet or some guy that does a morning show instead of fighting this pandemic, fighting the outbreak, trying to work on getting material supplies to the people that need it. That's where our energy needs to go. Forget about doing, cease and desist too. That doesn't even mean anything. The next thing that comes is legal action. So why get your lawyers involved in that and really fight for this country to make sure we can handle this pandemic?
Well, let me just tell you, you're right. I don't think that it merits doing anything about it. It's a political attack ad. What are you going to do?
Yeah.
People are trying to politicize the response. I've said it before. I'll say it again. No country has responded adequately. No country has responded in time. The president is a human being, just like the rest of us. It's taken time for it to sink in.
Yeah.
I think that this is a tragedy of massive proportions that we have to prepare for. But I will also say that the president's approval ratings are highest they've ever been.
That's true.
They still are, even during the pandemic. And what we need to do is come together as a country and work to get through this and survive it. And the thing that we need to do the most is to help our healthcare professionals, our law enforcement, and our government to do the job that we need them to do.
Exactly.
In Florida, Governor DeSantis was sent out this message about people committing fraud, charging for COVID tests. Here's what he had to say.
We've seen reports of a hospital in the city of Hialeah and Miami-Dade that's charging individuals $150 to get tested for COVID-19. Many of these are low-income individuals. And I just want to say that is not acceptable here in the state of Florida. The president has made clear, the relief bill has had, the tests are free. And we don't want to put individuals in any more difficult circumstances than they already are in a time of angst. So I'm going to ask Attorney General Moody to immediately investigate this hospital for price gouging. And I hope if there's a way to hold accountable that it will. But that is not the way we want people operating right now here in the state of Florida.
Wow.
And it's a low-income area, so it's even more distressing. Remember, folks, the tests are supposed to be available and free to everyone.
Everyone, yeah.
So if they're going to be getting them, it should be free. But also in Florida, they had spring break recently.
Yeah.
As you know, a lot of people defied the fact that we had a pandemic and that many states were shutting down, especially on the coasts. And Florida said, nope, we're having our spring break.
That's right.
A lot of people went out there. So a tech company got an anonymized cell phone data and focused on one beach in Fort Lauderdale, just one beach in Fort Lauderdale during spring break. And then they looked to see where those phones went after spring break, which is what you see on the graphic shown on the screen. So if even 1% of those people were infected, just imagine.
Wow.
Look where they went.
Spread all over. It really seems to be in kind of the center, off of
It goes up into Michigan. It goes up into
Minnesota, I see. And
Minnesota.
South Dakota, Nebraska.
Yeah.
All the way up to
Iowa.
New York. Boy.
Look how far people went. Things like Mardi Gras and spring break, all of these things will prove disastrous in the aftermath. We need to cancel all major events like this now. Stop all of these outbreaks from becoming worse. That includes cruise ships, which have all but stopped working around the world. and requesting relief. Look at Mexico, though. They are still allowing cruisers to disembark
Really?
in Mexico.
Oh, my goodness.
It's a bad move.
Mm-hmm.
Bad move. I was listening to the morning press conference with President Andrés Manuel López Obrador in Mexico today, and he had his health expert speaking to the crowd in a very brusque tone. A full press room where no seats in between were empty. It was just packed. And as he's speaking to them about not meeting in large crowds while they're in a large crowd, he basically said that we don't have to wear masks. People don't have to shut down businesses. They merely have to practice good hygiene and ensure that they don't have to wear hazmat suits. They don't, it very much felt like he was downplaying the importance. But in the end, he basically said that there is no treatment for this. There is no medicine. There's no medical treatment for the coronavirus because there's no vaccine. And any vaccine that comes out will not come out for at least 18 months. And by that time, most of the population will have gone through the disease process and will either be immunized from it and will no longer be carriers, or they won't. And I was like,
what?
So in other words, you're going to do nothing?
Yeah, pretty much.
That's what it sounds like to me. And as I said, the cruise ship industry is asking for bailouts of the president. Now I know what the president was alluding to when he said that these cruisers requesting a bailout from the United States are actually not based out of the United States.
Exactly.
So why are they asking for bailouts from our government?
Yep.
In this tweet, someone said all the major cruise lines are asking for bailouts from the U.S., yet Disney Cruise sails under the Bahamian flag. Celebrity Cruise is under the Liberian Maltese flag, and Carnival Cruises are under the Panamanian flag. All of them have done this to avoid paying taxes and employment law.
Yeah.
Just saying. So do you think that they should be entitled to get bailed out when they haven't paid into the tax base of the United States?
I don't agree with that. And plus, their customers, no customers are going to go on a cruise ship right now. And the majority of the people doing cruise are from the United States. And it's like, they're just going to lose money. I mean, and it's one of those things that maybe we will do without in our society, is get rid of the cruise ships, but they're business bound, and they'll have to figure out how to survive. And they've made lots of money. I haven't really looked at their financials, but I know they make a lot of money. They'll just have to ride it out and sit idle and clean their ships and get ready for a day that people can take cruises again.
Yeah, there will come a day that we can take cruises. I'm not really partial to cruises,
I
but
on a cruise. I like staying on land.
Every time I see stories in the news about the cruises, it is always something very scary. So
Yep.
I'm like, I'm good.
Yeah.
I don't need that. Meanwhile, Mexicans stuck in Peru made a video that is going throughout the country of Mexico, holding the Mexican flag and asking for help. 4 of them are from Tijuana. And they basically said that the Mexican embassy has abandoned them. They're asking for their stories to be told.
Wow.
They're not the only ones. Lots of people, even while the pandemic was brewing. Folks, I'm going to just say this again and again and again. Mm-hmm. We knew about the pandemic, the potential of a pandemic in October, in November of last year. We definitely knew about its spread in December. Mm-hmm. And by January, there were people taking measures to talk about preparedness. We did precious little, not just here in the United States, but everywhere else. Yeah. People panicked. Leaders worried about the economic decline, about elections, about all sorts of things that don't matter in the face of a pandemic, and that the pandemic doesn't care about. So there were people that decided, I already paid for this vacation. I'm not going to postpone my vacation.
Yeah.
You know, if I get it, I get it. In fact, even after we had, community spread in our country due to the pandemic, I saw people posting that they were going to buy tickets to Hawaii because, you know what?
There's only a couple cases there.
If they die, they die. These prices for the airplane tickets are too cheap. Guess what, folks? In response to COVIDiots like that, that refuse to take this seriously, most places, I wish every state in the country would do this, but Hawaii, most places are now requesting that if you fly in, you have to quarantine. It's mandated. You quarantine for 14 days. So if you're thinking of flying to Hawaii or Puerto Rico or something like that, think twice because you're probably going to be taken into quarantine.
And it'll be military type quarantine. It won't be like, choose your Airbnb for the quarantine deals. It's like, no. You'll be stuck in like a barracks or, a medical facility for 14 days on your vacation where you won't be going outside, seeing the sights, eating all the food and all that sort of thing.
One piece of good news, the Bacardi company has shifted gears and they are now producing hand sanitizer. That'll be useful.
Yeah.
Another
Cardi B should endorse that.
Oh, that's a good idea. It's the Bacardi sanitizer.
Yep.
Cardi B sanitizing.
That's right.
I think that she would love it. Mm-hmm. The Bacardi hand sanitizer. I mean, only during the pandemic would you have that combination, right? Yeah. Dyson, the vacuum cleaner, and I don't know what else they make, but they're also getting into the business of pandemic response and relief. Dyson is making a vent. As you can see here, Dyson is going to be making these ventilators at the request of the United Kingdom. Here's that video. Dyson is making 15,000 ventilators to help fight COVID-19. Dyson's most famous for making vacuum cleaners and hair dryers. It received an emergency order from the UK to make 10,000 medical ventilators after the country reported a shortage of supplies to fight the COVID virus. The company was contracted by the government March 17th. Just 10 days later, they unveiled a new ventilator called Covent, joining companies like Ford, GM, and Tesla in making the shift to develop the medical device. After announcing the new product, Dyson said it would donate an additional 5,000 ventilators. So governments around the world, 1,000 of those will go to the UK. A ventilator supports a patient who's no longer able to maintain their own airways, but sadly there is currently a significant shortage. Both in the UK and other countries around the world, the race is now on to get into the production. As of March 27, the UK confirmed more than 14,000 cases of COVID, including its own Prime Minister, Boris Johnson, and more than 700 related deaths. That was a report from Now This. I didn't know Boris Johnson had COVID.
I didn't know that either. I didn't know that.
Wow. There's another world leader that has it. It's just, it goes on and on and on. And sadly, Duke, this is from AJ Plus, the reality is that as more people die, people are dying alone and being buried without very many people. Limits on the numbers of mourners and the numbers of people that can attend funerals, or whether or not you can attend a funeral at all, are happening worldwide.
No.
Take a look. Could you narrate here?
Sure.
COVID is leading the funeral restriction around the world.
Exactly.
La Paz, Bolivia, capital has unlimited burial hours. Limited burial hours.
Mm-hmm. Just 2 minutes. It won't take longer. Please. I won't be able to. There has to be control because otherwise we're going to catch it. Then we'll get cremated over there. Australia has limited funerals to 10 attendees. Similar limits are appearing around the world. In response, some funeral homes are offering live-streamed ceremonies. I had a conversation with a customer who told me
It was very difficult for her to figure out which sibling to disinvite from the funeral. And then we had the idea to offer a live stream on the internet. Coronavirus is also upending cultural practices. Israel's first victim of coronavirus was buried in plastic to prevent the spread of the virus. Traditionally, Israel's Jewish dead are laid to rest in a cloth smock and shroud. Everything about how we do rituals of life, traditions, are going to be upended. Every single thing. And yet, amidst all of this, we have people doing horrible things. In the last 24 hours, I have seen cases of people going into grocery stores and deliberately spitting or coughing or licking food or shelves or produce in grocery stores. In the New York Post, there was a report of a woman that was arrested for coughing on $35,000 worth of food. Cops busted the woman who allegedly coughed on the food at a Pennsylvania grocery store this week in what was believed to be a very twisted prank amid the coronavirus pandemic. Margaret Serco, age 35, was hit Thursday with charges including threatening to use a weapon of mass destruction, making terroristic threats, and disorderly conduct by the Hanover Township Police. Chief Albert Walker told the New York Post. Serco visited the Hanover location on a small grocery chain, Garrity Supermarket, before 2:20 p.m. Wednesday and hacked on fresh produce, a small section of the bakery, the meat case, and grocery items.
Sure.
Co-owner Joe Fasula posted on Facebook during the sixth stunt that she allegedly yelled out loud, "I have the virus. Now all of you are going to get sick."
Oh, my God.
And during a preliminary arraignment, bail was set at $50,000 and Serco was transported to the Luzerne County Correctional Facility. Walker would not confirm whether or not Serco, in fact, does have COVID-19, but Fastula said she is not believed to be infected. However, authorities said they would make every effort to see that she did get tested. Quote, "While there is little doubt this woman was doing it as a very twisted prank, we will not take any chances with the health and well-being of our customers. We had no choice but to throw out all products that she came into contact with."
That is, I don't know why a person would do that. You know, we have so many mental health issues, and that's going untreated now. I mean, I was looking online that people still want to do support groups and stuff, and they can't. It's got to be online. They're not going to have, actual physical contact with their, with their therapist. But for someone to do that, and also having to throw away all that food, it's just like, what can you do, And I just think that's terrible. But also, it shows you that there is a danger for going and getting food. I mean, it can spread through the supermarkets. It can spread on plastic that's on the packaging. We did stuff in our program the other night that we covered that, wiping everything down and going through some of those procedures. And on our Facebook page, we posted a video of how you can go about doing your groceries and cleaning all of them to be more safe. But once again, this is the very beginning of us trying to protect ourselves. And we've got to do it right. So I guess that's what they had to do in that situation. But we have a lot to learn yet.
In another astounding report out of Australia, a Chinese woman was caught on camera spitting on the bananas at a suburban supermarket.
No way.
Is this an isolated incident? Who knows? I mean, obviously this is going around. This comes from a TikTok. Here is that video. Disgusting, says she tested positive for COVID and got caught spitting on the fruit. The officer is trying to arrest her as she resists him. There she is. And you see her purposely spitting or coughing. And she looks around as she does this.
She looks around like, did someone see me?
Did somebody see me coughing
goodness.
on the...
Why would someone do that? I don't get it.
I think that there's some... Look, I said this yesterday. Our underlying conditions, the crazy that's right under the surface of a lot of people that suffer from mental health issues that are undiagnosed or untreated
Yep.
is going to come out,
Yeah, you're right.
especially
Totally right.
during the isolation and the lack of access to treatment and support from the rest of the community. So, folks, this is why right now we must do everything to protect each other. There's always going to be an enemy at the gate. And we have to do everything not only to protect the most vulnerable in our society, but also our healthcare professionals and the frontline fighters of this battle. From Australia, again, we bring you a video of a mom with an urgent plea for her and her baby that everyone stay at home.
Guys, I am 39 years old and I am 26 weeks pregnant, nearly, with my baby. I've just been told that I have COVID-19 and I've been ill for 2 weeks. I've been in the hospital now since Saturday and today is Wednesday. I have pneumonia on both lungs and I'm fighting for me and my baby. It's not worth going out. Anything you think you wouldn't, you can get another time. I have 3 kids at home and a husband that I can't see. I don't know where I caught it from, but I'm very ill and I'm telling you now, if you're going to meet your friends for a stupid beer on the sea wall because the weather's nice, you're going to take this home and you're going to kill someone, one of your family members. Just stop going out, listen to Boris, and just don't go out, it's not worth it.
Boy, that's really good advice, but it's like, it's terrible. It looks so painful, that you're so debilitated.
Yeah.
That it's, you're just out, and she's went out for a beer and she caught it.
No, she said to other people, she's pregnant. She's not drinking alcohol,
okay,
honey.
misunderstood.
She said,
A strong
don't
Australian
go.
accent.
I thought she was Australian. She actually said Boris, so she's British.
I see.
I can't tell these accents apart. I'm sorry. I apologize. But she was saying, for those of you who couldn't hear her because she was breathing very labored. It was a very labored breathing, so it was hard for her to be heard. But she said that she has a husband and 3 kids at home. She cannot see.
Cannot see him.
She has no idea where she got it. She said, don't go out. It's not worth it. Don't go out and meet your friend for a beer or take a walk by the ocean. Whatever you're thinking about, it's not worth it. If you go out, you could catch this and bring it home to somebody in your family and kill them.
Yep, exactly.
It's not worth it.
It's not worth it.
No, it's not worth any person's life. We have to get this message, and we have to get it now.
You're listening to KPPP 88.1 Fargo Moorhead, bringing local color to your airwaves.
And I want for folks to consider the realities of what we are managing here. We are managing the risk. We are mitigating the damage from this virus. And that means that the idea of reopening by Easter is really something that, according to this article, is not a good idea. Yeah. It's an error of epic proportions, according to this article. And they shared a chart. This comes from Market Watch. We will share the link to the article in our comments of our show. But the article shows you the effects of social distancing for 14 days.
Really?
And if we social distance for 14 days all across the country. That will lead to a total of 128 million total infections, even with social distancing. If we social distance for 2 months, it will lead to 14 million total infections. There's still millions of infections, by the way, but the numbers are drastically reduced in the amount of people that are actually infected, and therefore it's also a huge reduction in the amount of people that are going to need urgent care or who are going to die. Folks, we really have to stop that curve.
Yeah.
We have to flatten that curve, stomp on it. We got to stomp on the curve.
Mm-hmm.
I bring you, to end our program, this heartwarming image of a grandchild visiting grandma through a glass window.
Oh.
This is the cutest picture. It's from Walsh County, North Dakota. Elena Martinez shares a smile with her 109-year-old great-great-grandma, Clarabelle Demers, at the Lutheran Sunset Home. That photo is by Larry Beery. Thank you so much for sharing that on social media.
Mm-hmm.
We all need a little smile, a little lift, and that was just what we needed to see. I'm going to leave you with a reminder from one of our animal friends about washing your hands. Here is a great video of a raccoon doing just that. Take a look.
He's washing his little hands in a little swimming pool.
Look, he's really scrubbing hard.
He's scrubbing hard. He's doing the 20-second thing for sure between his fingers. And
Yep.
he's doing a really good job.
I mean, if we could get everyone in the country
to wash their hands like this raccoon. Yes.
Yeah, look at how meticulous. Now he's doing the back of the hands.
Yep. Uh-huh.
I think he's doing the wrist now. He's completely submerged them in the pool. This is not just for fun.
Yep.
He's washing his hands. Wow. Come on, guys. If the raccoon can do it,
we can do it.
So can you. Folks, that's all I have for today. Stay safe, everyone. Thank you for being with us at A Mexican Crossing Lines with your host, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You've been listening to 88.1 FM, KPPPLP, Fargo-Moorhead, where we are adding local color to your airwaves. God bless and good night.